UTIs, three letters that bring in a whole bunch of discomfort. The pain, the urgency, the disruption to daily routine. Few things in life are as frustrating as dealing with a urinary tract infection. But here's the good news. You're not alone and you do not have to suffer in silence. Welcome to Health Mantra. I'm Heather, and today I'm joined by consultant nephrologist and transplant physician from Manipal Hospitals, Goa, Dr. Hardik Patel, here to unpack everything you need to know about UTIs, what causes them, how to treat them, and how to keep them from coming back. Dr. Hardik Patel, welcome to the show, and thank you so much for joining us here today.
Thank you very much. It's an honor to be here.
So, doctor, now urinary tract infections affect millions every year, and not all UTIs are the same, and not all of them are harmless. But before we get into all of that, could you explain to our viewers in very simple words what exactly is a UTI?
UTI, or an urinary tract infection, is an infection that occurs in any part of the urogenital urinary tract, so which comprises from urethra, bladder, from ureter till kidneys. Based on the area of affection, the UTI classified into various types. That is, when it involves the urethra, it is called urethritis. When it involves the bladder, it is called cystitis. When it involves the ureter, it is called urethritis. And finally, the most severe of all is that when it involves the kidneys, it is called pyelonephritis.
And what could be the main causes of such a pesky infection, shall we say?
It is most commonly caused by bacteria. The most common bacteria associated with UTI is the Escherichia coli. This is a normal organism which normally habitats into our intestine. They find a way to ascend into and get entry into the urinary tract and thus cause infections. Besides this bacteria, there are other ones which are also there, such as Protease, Klebsiella, Pseudomonas, Acinetobacter. These are the other ones. Along with this, there could be other fungi or even viruses which can cause urinary tract infections.
And women, as we all know, have shorter tracts. So is it true that women are biologically more prone to such infections?
That's great. It's great that you know that. Usually, women, especially those of the sexually active age group and postmenopausal women, these are the most common age group and most common people who are affected with this. It is said that almost 60% of these women suffer from UTI at least once during their lifespan. And the most common reason, as you rightly said, that it is the shorter urethra. This is one part of it. The other part, it's its close proximity to the anal region and the vaginal region, which gives an easy passage for these microorganisms to get entry into the urinary tract and thereafter incite infections there.
Doctor, what would be the classic signs, that somebody is suffering from a UTI?
Coming to signs, the most common symptom of patient suffering from urinary tract infection is that of patient complaining of burning while urinating. This is the most common symptom, also known as dysuria. Besides this, there are other symptoms such as increase in urgency, increase in frequency, foul odor to your urine, and also passing turbid urine. These are the common symptoms of a low-grade infection. When the infection is severe, patient can have high-grade fever associated with chills and rigor. Sometimes they can also have nausea, vomiting, along with flank pain. In some age group, especially the younger group, that is the children and the extreme elderly, they may have vague symptoms in the form of confusion, just fever or weakness.
You spoke about the elderly, you spoke about children, you also spoke about sexually active women and postmenopausal women. Doctor, what about UTIs in pregnancy? Because that does happen. Is this risky for the mother and the baby?
Definitely. In fact, it's a life-threatening infection if it occurs in the pregnancy. It increases the risk to this pregnancy in the form that it endangers the life of the mother in the form of her suffering from a severe kidney infection which can be life-threatening, or and also it can cause the risk of preterm labor and increases the risk of low birth weight babies. So what we do is, in pregnant women, we screen all of this age group, these people, and we treat them even if there is asymptomatic bacteriuria despite no signs and symptoms, and that too we treat them aggressively. This is just to prevent such complications in this age group.
As a preventative measure.
Yes.
Would recurrent UTIs also affect fertility or conception?
No, recurrent UTI as such does not affect conception and fertility unless they have been recurrent such episodes of severe infection wherein the kidney is scarred and there is severe renal impairment, which then would in turn decreases the possibility and probability of them of getting normal conception and delivery.
Doctor, let's talk about things that we can control, from hydration to hygiene. How big of a role does, say, a daily routine play in keeping a UTI away or in leading to a UTI?
Definitely, especially the lifestyle change, that is increasing hydration. Maintaining a good hydration is very important and will prevent and go into making a woman who is being suffering from repeated UTI to come down drastically. Along with this, there are other measures such as preventing from holding the urine for a long time. Along with this, there may be need to change the practice that wiping from front to back rather than back to front. Along with this, even a small change, that is the passage of urine prior and after a sexual act, also would decrease the risk of patient and the woman getting from an episode of UTI.
Doctor, you just said that we need to hydrate well to flush out, say, a potential UTI. But is there such a thing as overhydration, too much water?
Yes. Definitely, for anything we require an adequate hydration. This would include somewhere between 2.5 to 3 liters of water intake. Anything more than this, especially in vulnerable age groups such as those patients having heart ailments or those with kidney impairment already, they can suffer due to overhydration, and hence a balance has to be kept between the intake and the output, and on an average 6 to 8 glass or around 2.5 to 3 liter is just enough for preventing an UTI.
What about foods? Are there certain foods or drinks that could irritate the bladder?
There is no definitive conclusive evidence that the food items per se increases the risk of UTI or irritate the bladder mucosa. It is just that sometimes one may feel a bit of symptoms of increase in burning like sensation if after taking very spicy food, and especially not hydrating equally well during that time.
So spicy food, alcohol, I think?
Alcohol would not usually cause an irritation to the bladder and would not cause such a symptoms actually.
Okay. Now, suppose somebody suffering from a UTI. So are there any home remedies that they could take?
With regards to if the patient has just a simple lower urinary tract UTI, that is just cystitis, then patient may take excessive or normal hydration. Along with that, they can sometimes use this cranberry juice. They are said to prevent and treat lower urinary tract infection. However, it is just the lower urinary tract infection and not the severe infections where there is fever, nausea, vomiting and abdominal pain.
So, at what point do we need to stop Googling, say, for example, and go see a doctor? At what point should perhaps a neurologist or a nephrologist step in?
So, whenever there is escalation of symptoms, that is, or persistence of symptoms for more than 48 hours despite the common measures, when the patient gets history of fever associated with flank pain, associated with decrease in urine output, or has severe weakness to cause him to impair doing his normal routine, that is the time that patient should rather see a doctor who would treat him properly rather than going with the Google search engines.
Okay. And are there any tests that you do to confirm that somebody suffering from a UTI?
Yeah. So in order to confirm a urinary tract infection, we need signs and symptoms suggestive of urinary tract infection, which should be accompanied with an urine analysis which is suggestive of having numerous or more than 10 WBCs per high power field, which may or may not be added with the help of urine culture test, which may show organism or no.
So your WBCs would suggest that there is an infection for sure.
Yes. Along with WBCs, the newer test also has something called nitrite test and leukoestrase test on the urine dipstick test itself. So
Okay.
they also serve as a simple measures to tell us that whether the urine infection is significant and needs to be treated or not.
Are there any home tests, any home tests that are available?
Usually there is no over-the-counter urine dipstick which is available for sale, but elsewhere there are measures wherein a person who is suffering from recurrent UTI, those people can acquire this urinary dipsticks and keep it there with themselves. If they know to read it well, they could interpret it as well.
Okay, so there's no, like how we have your home pregnancy test, there's no such thing for a UTI?
No. As of now, not commercially available.
Okay. And, how would a doctor treat a UTI? For home, we would just have excess water and say your cranberry juice. But how would you treat it?
So, treatment of an UTI depends on the severity of the infection. If the infection is just a lower urinary tract or a simple cystitis or a simple UTI, one may just need a hydration and a short course of oral antibiotics lasting from 3 to 5 days. Whereas, if the infection is severe or if it is complicated, especially in diabetic, in male or those with patients having anatomical abnormalities, these patients would require longer duration of antibiotic, 7 to 14 days, sometimes also IV administration for the same antibiotics and hospitalization for the same.
So I think, doctor, what you're trying to say is don't Google, just go see a doctor. It's just a matter of, oral antibiotics for 3 to 5 days and you should be sorted.
Yes.
Are we seeing antibiotic resistance, more and more antibiotic resistance these days because of perhaps your, treatment with antibiotics specifically for UTIs?
Yes, it's a huge burden now, especially with the overzealous and inappropriate and improper dosage of antibiotics. There is this huge antibiotic and antibiotic resistant burden which is there across the globe. What we have seen is those antibiotics which the organisms were sensitive to initially now have developed resistance. There is increased resistance to fluoroquinolines, there is increased resistance to even the extended spectrum beta-lactamase. So now, in fact, we also come across some urinary tract infection where there is pan or extensive drug resistance and we are not left with any antibiotics for them.
So then how
So it's a PT state, and
Okay.
Thus we need to ensure that antibiotics are responsibly used and not to be
dispensed with over the counter,
yes,
perhaps?
true.
You're a nephrologist, doctor, so there's often confusion between, say, a bladder infection and a kidney infection. Could you tell our viewers how these two differ?
See, the bladder infection, which I had earlier said that it is cystitis, it comes under a simple infection which is restricted to the Bladder. The treatment and the severity of the bladder infection is very mild. When this infection ascends and involves the kidneys, they get transformed into something called an pyelonephritis, which is a complicated UTI, which itself is a severe life-threatening condition. So in that case, one has to be very vigilant and one has to take care that we treat it properly. So simple cystitis versus a severe kidney infection, both have different came all together. The simple cystitis requires treatment with 3 to 5 days of oral antibiotics or even sometimes single dose of antibiotics. Whereas in case of an kidney infection, there is risk to have sepsis, there is risk of risk to life, and thus it requires a proper treatment of 7 to 14 days, either oral or at times admission and IV administration for the same.
So basically a neglected UTI can turn into sepsis,
yes,
which is life-threatening. Some people also seem to get UTIs over and over again despite doing everything right. Like you said, you need to pee before and after a sexual act, you need to wipe front to back, you need to hydrate. Despite doing all of this, many people still get UTIs. Why do you think that happens? And is there anything they can do?
Usually, this you are asking in case of recurrent UTI.
UTIs, yes.
So recurrent UTI has itself been a big thing. You need to see at various stages what is the main risk factor which is causing this recurrence. Most of the time they are associated with some anatomical factors such as the benign prostatic enlargement, or if there is an stricture in the urethra, or if there is an anatomical abnormality in children in the form of vesico-ureteric reflux, posterior urethral valve, or maybe atrophic kidneys. These are anatomical factors. Along with this, there are functional factors such as neurogenic bladder, those with bedridden state, those with spinal injuries. These are the conditions where there is increased risk for this UTI, and along with this, another important factor which I have to tell is the hormonal factor also, especially in case of elderly female postmenopausal. They have some hormonal changes in an area around the genitourinary tract, which predispose them to have atrophic vaginitis and increase the risk of urethritis and repeated bladder infections.
Doctor, let's do a quick round of myth or fact. So I will say a few statements, and if you could very briefly tell our audience whether there is any truth to them. So the first one is that holding in urine causes a UTI. Some people go out of their way to avoid peeing out in public perhaps, and they prefer to hold it in till they get home. Can this really cause a UTI?
Yes, it's a fact that holding the urine increases the risk to UTI, because there is increased amount and the time wherein the organisms can multiply themselves in the urine which is left behind and cause UTI.
What about, people usually hold in urine because you don't want to use, say, a public toilet. So does using a public toilet risk contraction of a UTI?
I would say it's a myth. The risk of patients suffering from UTI by holding the urine rather than using a public latrine is way higher than using the public latrine. Although I agree with the fact that the surface contact has to be minimized and it increases the risk, but the risk is much lesser than you holding the urine inside you.
So what you're trying to say is just go, get it done, don't hold it in.
Yes, definitely. That's the take home.
Doctor, what about things like, bubble baths and tight clothes and say your public pools or water parks? Would these increase risk?
Yes, definitely. They are responsible for altering the pH and also cause trapping of moisture, which in turn increases the risk to urinary tract infections.
Are they contagious?
No. The urinary tract infections are not contagious. However, sexual act can itself trigger mechanical factors which increases the risk, but direct causation of it being contagious is not there.
So you're saying that it cannot be transmitted from person to person?
Yes.
What about, there are so many myths on the internet, one of which was this. Is there any other myth on the internet that you would like, to be gone?
So the myth which I feel which is very rampant and circulating else everywhere is that cranberry juice itself can cure urinary tract infection. So I want this myth to be erased from the internet with the fact that we know that cranberry juice can prevent UTI, but it cannot be used to treat UTI. That has to be clear.
So what you're trying to say is that you can use a cranberry juice or a cranberry capsule to prevent the UTI and to treat the initial symptoms?
Yes, yes.
But not once, say, you've got a fever, developed a fever?
Yes.
Okay. Are there any preventative steps that you would recommend, for somebody who keeps getting UTIs?
Okay. Some of these we have already discussed. The most important being maintaining adequate hydration, maintaining proper hygiene, like preventing excessive holding of urine back, wiping from front to back, then use of harmful chemicals, especially those newer vaginal sprays, has to be totally stopped. In fact, the only thing what the body requires, it's normal change of garments after probably a sexual act, or after if it is getting, meaning if it has already got soiled. So that is what is required, and avoid use of tight and synthetic undergarments. These are important ways wherein you can prevent infections.
I think that is of a lot of help. Finally, doctor, if there was one thing that you could say to someone who is embarrassed to talk about urinary health, I mean, you must be seeing that many patients delay coming to a doctor because they are embarrassed to talk about it. If there is one thing that you could tell our viewers, what would it be?
I would say that one has to be aware that the urinary health is very important, and its urinary tract infections are extremely common. Most of them are mild and are easily treatable. So they should not be hesitant to come forward and discuss with regards to their urinary health and symptoms. Secondly, also the stigma around it should be just meaning it should be normalized, just like we have normalized with regards to patients suffering from heart diseases and skin diseases. It should become a norm. It's not nothing or
to be embarrassed about.
Yes, definitely.
Thank you, Dr. Hardik Patel, for sharing valuable insights and for the empathy.
Thank you.
If you've ever had a UTI or you know someone who has, we hope today's conversation helped you feel a little more seen, a lot more informed, and way less alone. UTIs may be common, but they shouldn't be ignored, especially since timely care and treatment can go a long way in preventing serious kidney complications, as Doctor just said. Remember to stay hydrated and don't delay medical care. If you'd like to consult Dr. Hardik Patel in person, he's available Monday through Saturday, 10 a.m. to 5 p.m. at Manipal Hospitals in Donapola, Goa. Thank you all for tuning in to Health Mantra. This is Heather saying bye for today. Until the next one, keep watching Prudent Media.